But the fact that the president is saying this and saying, well, you Republicans want to hurt Medicare, for example, I find to be quite ironic, extraordinarily ironic, maybe even a tad hypocritical. In Washington, D.C., you have to watch what people do, not what they say. In the waning days of the last Congress, once again, watching what people do, not what they say, President Biden, who has accused members of my party are wanting to hurt Medicare, tried to cut Medicare himself. The Centers for Medicare and Medicaid Services, CMS, as you know, every year proposes what's called a physician's fee schedule for doctors who treat Medicare patients. President Biden, CMS, last year proposed to cut all physician payments, all provider payments by 4.5%. He didn't want to lift up Medicare. He wanted to cut it, not Republicans, the president. Now, why is that important? Well, a lot of physicians won't take Medicare. We can't turn a profit. We're not looking to make, say the physicians, obscene profits, but we're in the middle of inflation. Healthcare inflation is as real as anything else. We're paying more in rent. We're paying more for our nurses. We're paying more for supplies. And the Medicare fees that we're paid to treat folks on Medicare they're not keeping up. They're just not. And so here comes President Biden through his Centers for Medicare and Medicaid Services, CMS. Here comes President Biden, the champion of Medicare. He proposed a 4.5% across-the-board cut for every physician treating Medicare in America. So I'm sitting there listening to this, hearing the president say all Republicans want to do is hurt Medicare on the left hand, but on the right hand, he's trying to cut all the physicians and other providers in the program. We have 900,000 people in my state in the program by 4.5% in the middle of raging inflation. Just found that extraordinary. So I introduced a bill, Mr. President. The name of my bill was the Protecting Medicare Patients and Physician Act. It would have eliminated that 4 to 4.5% cut that President Biden wanted to impose on Medicare doctors. And I came to the body of this Senate to present that bill. And I didn't come to my colleagues just with a problem. I came with a solution. I'm not suggesting fill the hole by borrowing the money. I said I've got a solution. I found $9.8 billion sitting in a fund at the Department of Health and Human Services. It was called the Provider Relief Fund. This Congress appropriates lots of money to our health care providers to help them deal with COVID. And not all of the money, thankfully, was needed. Many of the health care providers returned some of the money. And at the time I presented the bill, there was $9.8 billion that had been returned. Way more than enough to prevent a 4%, in some cases 4% plus cut to Medicare that President Biden proposed. I came to this floor to ask for unanimous consent. And that, as you know, Mr. President, is where you present a bill and if nobody objects, it's passed. But there was an objection. And it came from a good friend and a good man, Senator Ron Wyden, who's chairman of our Finance Committee. There aren't words in English to express how much I Ron Wyden. But Senator Wyden came to the floor and he said, Kennedy, I'm going to object to your bill. And he said, I don't want you to worry about this. We're aware that President Biden has proposed to cut every Medicare physician in America, but we're not going to let him do that. We're putting together a budget bill right now. We call it the omnibus. We're putting together a budget bill right now that's going to address that. And that's why I'm objecting to your bill. Your bill, Kennedy, is unnecessary. But after the omnibus passed, I didn't vote for it, in part because I didn't know what was in it. But after the omnibus passed, I went back and looked, and lo and behold, the omnibus bill, which passed at the encouragement of President Biden, and with a lot more votes from my Democratic friends than my Republican colleagues, had a 2% cut for every provider, every physician that treats a Medicare patient in America. 2% cut. That's better than a 4% cut, but it's still a cut in a time of raging inflation. That pool of money, the Provider Relief Fund that had $9.8 billion in it, maybe $15 billion, sitting there in an account, unspent, unappropriated. What happened to it? I don't know, but it got spent on something. But it didn't get spent on helping Medicare doctors and patients. They got cut 2%. So I'm going to end like I began. In this town, you have to watch what people do, not what they say. The president can try to blame the Republicans and say, well, they don't want to seriously negotiate about controlling spending and controlling debt. All they want to do is cut Medicare. He already did it. He did it in December.